I have very strong views on this. I do not think there should be physical classes, whether it be colleges or public schools, middle schools, high schools, elementary schools. Right away, I will acknowledge that yes, that is a huge issue for a lot of different reasons. You have parents who need to go to work. Where are your kids? Right. There are a lot of students that actually rely on the food, the free food that is offered in public schools for them to get by. Um, I acknowledge all of these issues that exist. However, this is unlike anything. People are gonna, well, we've seen the Great Plague of the 1600s. Shut up. In recent memory, this is insane. Like, this is such a huge issue, and we need to respond accordingly, and all of us are responsible for making smart decisions. There's a lot of selfish people, and I've seen a lot of selfish actions during this time, and truthfully, in my opinion, they are disgusting. I don't think people are understanding the severity of this issue, and I think it would be a huge mistake to open up the schools. I read this really great article that broke it down into some categories. I don't have it right now, but let me tell you the rationale for it. It was an opinion piece by a doctor somewhere, and they said, simply put, these are the reasons why they should not open up. One, we don't have a vaccine. Why would you have people in close proximity to each other when there is not a vaccine, when the virus is not slowing down? And scientists have already said, yes, historically viruses can mutate and become stronger. And so why would you continuously feed this virus and continuously let it spread? It may make our jobs harder long term, because the longer the virus lives, the faster it mutates, and the harder it is to find a vaccine. Okay. The other reason is the healthcare system. The healthcare system, speaking in the United States, does not work for absolutely everybody. Okay. This is one of the reasons that they are incentivizing people to stay home with these checks. The checks are an incentive for you to stay home. And that's what some people don't understand. And another reason that they're doing it is because, well, the primary reason that they're doing it is because this country cannot afford for an overwhelming amount of people in communities to be hospitalized. Not just because of the lack of spaces that exist in hospitals for such a calamity like this one, but because the dollar signs attached to it. Nobody wants to pay for your health care. Nobody wants to pay for the vaccine that's going to help make you feel better. And now times that 100,000. Nobody wants to do that. Another reason, testing is still not happening the way that it's supposed to happen. Whatever death toll you see, however many tests your county is saying that they are reporting, that is not an accurate number. There is way more. And there are way more people who are not being tested. And just because they don't feel the symptoms or they just have one of the symptoms doesn't mean that they don't have the virus. They may have it and they are not part of that number. And so because there is a lack of testing, you don't know how many people have it. Multiply whatever they say your county has or a state has, multiply that by 2. That's how many people Vapi Chulo thinks actually has the coronavirus.
Yeah,
Should,
I've seen stories of people who have gone to the doctor's office with symptoms, um, but there's simply no test. So they say, hey, we think you probably have it. You should isolate yourself for a couple of weeks and not doing anything, but we can't tell you for sure. So those people don't get counted, but they have it. The doctors know they have it, but they can't. There's no real validation there. So the numbers, for everything, for the world, the country, not only cases but deaths is severely underrated right now.
Bro, you want to hear a scary thing? Yes, again, going to just emphasizing that just because you don't feel it doesn't mean you don't have it. Think about just think about a college, bro. If you haven't been to college, you've seen it in the movies or TV shows, or you visited somebody who lives in a residence hall, bro. Them joints is stuffy. Them joints is stuffy. Everybody know, and sometimes people don't have the best intentions when or have the best cleanliness habits. You got your HVAC system, and yes, the disease can spread that way. By the way, I mean it has to be concentrated a lot. I'm not gonna over exaggerate, but that is a reality. Imagine eating in those dining halls, bro. I'm not going to any buffet for 2 years. Like that is crazy. And then
Yeah.
you know what? And you're giving people an excuse to conglomerate. If I am in college and I'm a first year, I don't care if that is some students, right? Because I'm not assuming that all first years will be irresponsible. But if I am trying to get in with some people, right? Somebody's inviting me to a party. I'm not thinking about COVID-19. I'm going to say, oh, this has been going on for 7 months now at this point. Everything has fizzled. I'm going to go. Listen, there was an article. Oh, man, there's an article I read last week. Over there, it was either China or Japan. There was this one person that went to like 6 nightclubs. That he got 25 people infected, and they were
I heard
able
about it.
and they were able to trace it back to him. That's insane that one person was able to get 25 people infected. That's just nightclubs. Think about a college campus. Then that you have just made your college campus and the community outside of it a quarantine zone forever until this vaccine exists.
Yeah.
That's insane. People need to think about the worst case scenario and make sacrifices now so that the sacrifices later on aren't as severe.
No, I agree 100%. I mean, it's just, mind boggling. I just think about, football games. Like you look at the stadiums full of people, all these people going to the bathroom, getting concessions, drinking beer, just interacting with everyone, just squeezed together. Like I couldn't imagine, if we were to open up at full capacity now, within, a week, there would be millions of corona cases virus reports.
And the
And it's already
scary thing,
happening.
that's what I'm
If,
saying. The scary
if you,
thing is that it seems like that's what's happening or what's going
yeah,
to
if you
happen.
look at all the states that have gone to, full reopening or even partial reopening measures, like Texas, Georgia, they're reporting these big increases in cases, several times higher what the rate of increase was when they were on lockdown. So they all opened without meeting the federal guidelines. It's funny, is like, the president on one hand is saying everyone open, everyone open, everyone open, and then yet the federal guideline says, well, you can't open until you've had noticeable decline for a long period of time. Right. And not one state that opened had long decline for that period of time before they opened up. But now people again, infected left and right. So what are you going to